Hi, this is Dr. David Wade. I wanted to talk to you for a minute about the damaging effect of forward head posture, or FHP. Forward head posture is a really traumatic problem that occurs with a lot of people, and basically what happens with these people is that the effect of posture on your health is becoming progressively more evident. Spinal pain, headache, mood, blood pressure, pulse, lung capacity, all of these types of symptoms are among the functions most easily influenced by posture. The corollary of these observations is that many symptoms, including pain, can be moderated or eliminated altogether by improvement in the posture. One of the most common postural problems is the forward head posture, or the FHP. Since we live in a forward-facing world and we have this repetitive use of computers, TV, video games, texting, trauma, and even backpacks, all of these things have forced the body to adapt to a forward head posture. Repetitive movements in a certain direction, they'll strengthen the nerve and muscle pathways to move that way more readily. So in other words, if you're constantly looking down, the effect of gravity on your body is that your head's going to draw forward. An example would be the adaptation of the body to do gymnastics easily after repetitive practice. Your body becomes accommodating to the types of activities that it's involved with. It's the repetition of the forward head movements that's combined with poor ergonomic postures and or trauma that causes the body to adapt to this forward head posture. There are many causes, as mentioned. Backpacks, for example. Children are now using backpacks to carry school books that are weighing up to 30 to 40 pounds. This forces the head forward to counter the balance of the weight of the backpack, and that head shifts forward, and that results in abnormal stress to the discs and to the joints and the nerves of the neck and the shoulders and the lower back. Computer ergonomics. People are spending more and more time these days in computers, and positioning your computer screen too low, coupled with the repetitive movement of moving your head down and forward to read the screen, that is a primary factor in forward head posture. Video games and television. Most kids use extremely poor posture when playing video games and watching TV. Repetitive sitting in one position for long periods of time causes the body to adapt to this bad posture. And now with the advent of these cell phones, people are texting more and utilizing their cell phones more, so we have something now called texting neck, which is relative to the head posture shifting and the forward head posture. One of the most common problems that pretty much anybody that's from the age of 16 to 25 has probably been involved in a car accident. We have pretty high statistics that show that almost 100% of us have gone through one or more auto accidents in that time frame. And trauma, not only car accidents, but falls and other types of trauma can create a whiplash type of an injury, which results in muscle imbalance, and the spring curve of the neck goes away. And with that trauma, it pulls the spine out of alignment, and you end up with that forward-facing head posture. The long-term effect of that is it accelerates the compression stress on the joint, and it leads to long-term muscle strain, disc herniations, and it has a negative impact on a number of things, including, as I mentioned before, blood pressure, arthritis, and pinched nerves. Even people like the Mayo Clinic have recognized forward head posture. It's also one of the leading causes of tension headaches and temporal mandibular joint problems, sometimes referred to as the TMJ or jaw pain, that leads to pain, headaches, and bite problems. There's also some evidence that exists that postural positions can affect the nerve tissue by altering the blood flow to the spinal cord. And even to the point as the head shifts forward, there's some tethering on the spinal cord, which strains and stretches the nerve, which the research shows can reduce the strength associated with that area by up to 70%. So that means the muscles are having to work progressively harder because the strength is diminished because of the stretch on the nerve. These types of problems with forward head posture left uncorrected can potentially suffer chronic and many unpleasant conditions like pinched nerves and stretching in the blood vessel, tethering of the spinal cord, leading to stress and accumulation of damage to the connectors within the neurons of the body, and other types of immediate problems like thoracic outlet syndrome, pinched nerves, fibromyalgia, muscle and tissue pain, chronic strains, and early degeneration and progressive arthritis. It's known that chronic strain to a joint will accelerate the deterioration and the aging of that joint by as fast as 6.5 to 7 times faster than normal, according to the most recent research that I've observed. What that basically means is that your spine ends up aging in dog years instead of people years, because you've got like 7 times faster the deterioration as a result of this chronic strain. What we're attempting to do with any patient that comes into the office is to identify the postural stresses that we have. We have a phenomenal program called the Posture Pro, which gives us specific information about stresses and deviation degrees relative to your posture, and based upon that can give us some very specific information as to what needs to change, how much it needs to change, and we can monitor that. We also can show you where you are currently, compare that to normal, and also compare that to where it's going to be in the future if you don't change it. So I can rest assure you, if you're suffering now and you don't correct your posture, you're going to suffer for a long time. For you, as we make improvements in this, it may seem like a miracle. For us, it's just Wade Chiropractic. This is Dr. David Wade wishing you good health for a lifetime.